Do you know how hopeless is Parkinson's patients feel? Probably no. We will never know how hopeless is Parkinson's patients feel deep in their heart. In 2017, an American survey showed that Parkinson's disease patients are so emotionally affected. When asked to describe Parkinson's disease in one word, people with Parkinson's disease described their experience as scary, frustrating, annoying, life-changing, deliberating, and challenging. In response to another survey, when they asked what emotion they experience, many people say they feel hopeless about their future life. Have you ever talked to someone with Parkinson's disease, or do you have a family member with Parkinson's disease? I have met a Parkinson's patient, and she told me that she described her life as like a living death, dragging her body to the end of the life. She has no idea what will happen to her life as Parkinson gets worse and worse. The on and off phenomenon of Parkinson's disease. The on and off phenomenon refers to a switch between mobility and immobilities in patients treated with levodopa. It occurs as a worsening of motor functions at the end of the dose, or as a wearing off, or as sudden and unpredictable motor frustrations. She described the on and off of a body is no different like a confinement of handcuff. Let us know more about how PD affects mental health. We know that Parkinson's disease is a brain disorder that causes involuntary and uncontrollable movement because of a lack of dopamine in our brain. We also know that there is a loss of nerve cells associated with Parkinson's disease. Although much research and study is underway to try to find and identify possible causes, however, the cause of PD is still unknown. The drug treatment of PD is still not perfectly enough to cure PD. We are all working hard to give PD patients hopes that one day there will be a solution. Giving hope to the PD patients, please see our videos. If you support our work, please share, like, and subscribe with us. Thank you.
Today, we will talk about Parkinson's disease.
According to the Hong Kong Hospital Authority, there are about 8,000 Parkinson's patients in Hong Kong, with the majority of patients are aged 60 or above, accounting for about 1% of Hong Kong's population. There are more than 30% of the world's Parkinson's patients are in China.
The most obvious symptoms of Parkinson's are tremors, pain, slow movement, stiffness, low voice, writing ability, etc. The inability to move the body is likely a feeling of confinement. Parkinson's disease is a progressive disorder caused by the degeneration of the nerve cells in the part of brain known as the substantia nigra, which control movement. These nerve cells, die, or impaired, will cause problem to produce dopamine. So, too little of dopamine will lead to vast health issues, like Parkinson's disease. Is there a method for the treatment of Parkinson's disease? Up to now, Parkinson's is a disease that is incurable and it relies mainly on the medication and the amount of dosage will bring influential side effects. There are 5 stages of Honyar scale for Parkinson's. At the initial stage, one can move on their own, but at the late stage, patients will be sedentary and even bedridden because of physical movement limitations. Most of the Parkinson's patients feel hopeless with their life, and no difference, like a living dead, dragging behind the world. Dopamine is a neurotransmitter that your body makes it, and your nervous system use it to send message between nerve cells. It's not only responsible for movement, but also think, strive, reward, or find things interesting. The dopamine in the VTA, ventral tegmental area of the brain, aim as a rewarding motivator. So, you should do more pleasant, happy, cheerful things, such as exercise, reward yourself, or motivation to accomplish your goals. Even elder couples should be in love motivation or nourishment, which enhance their dopamine level. Let me tell you more. I knew a British gentleman named Chris Earnshaw. He is a PhD in neurology field. He lived in Japan for 30 years and works at Tsurumaki Onsen, which a large rehabilitation hospital in Tsurumaki, Tokyo. Starting from 2018, he conducted a pilot study, which he focused on the use of biomagnetic pair therapy, mainly for the treatment of elderly patients at the late stage of Parkinson's disease. The results of his study covered the participation of more than 400 practical treatment. As a result, 75% of the patients had significant improvement to the point that they are ready to go home for recuperation instead of hospitalized. Patients proved to have good mobility, less or no pain, and better body balance. The other 25% of patients showed considerable improvement in mood. Now, let's see the replay of the documentary testimonial. This is really a very inspiring result for PD disease, which claimed to be incurable. Biomagnetic pair therapy is a non-injection, non-medication treatment with no side effects, mainly to enhance the body's immune system and self-healing ability. Actually, we all have an off switch in our brain. When you feel depressed, unmotivated, unhappy, or anxious, turn on your switch. Try to activate yourself, eat a good meal, sleep better, and find your best friends to do something happy to boost your dopamine level. So far as I know, the use of biomagnetic pair therapy for PD patients is not available in any country, and Japan is still in an initial stage from being prevalent. Biomagnetic pair therapy proved to have the significant advantage that patients undergo no suffering for medication, side effect, and pain tolerance. Last but not the least, it provides a better solution for medical, economical, and social burden.
I am a biomagnetic therapist in Hong Kong. Anyone who needs more information is welcome to contact me.